chapter 6, page 178. And tonight we're going to start talking about the skeletal system. We have some subsequent chapters that will also deal with the skeletal system. For starters, we're going to talk about the functions of the bone and the skeletal system. So the bone is an organ made up of several different tissues: bone, cartilage, dense connective tissue, adipose, and nervous tissue, and they all work together. This entire framework of bones and their cartilages constitute the skeletal system. So the skeletal system has several functions, and you can see those on page 178 in detail. But here we have an outline of that. So they provide support, they protect internal organs, they assist in body movements. They help with our homeostasis by storing or releasing calcium and phosphorus, among other minerals. They participate in blood cell production, and they store triglycerides in the adipose cells of the yellow bone marrow. And we'll talk about all this stuff as the lesson progresses. Structure of bones. So this is still on page 178, but if you look at page 179, you can see figure 6.1. And that's going to give us this diagram here that I'm showing you right now. But let's go over this outline first. So a long bone consists of several parts. The diaphysis, which is the shaft, and you can see that there on figure 6.1. Let's see here, I'll just go down a couple slides. So you can see this. This is what we call a long bone. And you can see this diaphysis. So, and this would apply whether it's a femur or a tibia or a radial radius or an ulna. You can see this is just a kind of a standard model for a long bone. And then it has the two epiphyses, and those are the distal and proximal ends of the bone. So you can see in this view from figure 6.1 that you've got this distal epiphysis and this proximal epiphysis. And that's just relative to where it is on the body. And if we're talking about the humerus, you can see that here. So if we take this and just kind of magnify it, we see this is the proximal because it's closest to the center line, and then this distal end of it. So we should all be familiar with our anatomical positions, and understanding what I'm saying when I talk in distal and proximal shouldn't be a problem for us at this point. Two metaphyses. And this is the region between the diaphysis and the epiphysis. So you've got one at either end of the bone. There is some cartilage that goes on in here. This epiphyseal line is actually cartilage. And if you notice then that this is contained within this metaphysis. And then you've got articular cartilage covering both epiphyses. So that's true that cartilage that kind of outlines or lines the bone. And from birth, you should have this articular cartilage aligning either end of your bone that helps to reduce friction and to give it a little bit of more of flexibility and kind of a little bit of a padding there. So that's the purpose of that. And then the periosteum, which is the connective tissue surrounding the diaphysis. Let's have a look at that. So we can see here that we've got the diaphysis is the long shaft of the bone, and then there's this kind of, they call it a periosteum, and that just kind of shrouds the bone. So it's sort of a protective layer in that sense. Then you've got the medullary cavity, which is the hollow space within the diaphysis, and if you can see that here at this, it's got this cross section. The bone is a little bit hollow at some point, and being hollow is a good thing. Your bone is very strong, and we're going to talk about things to help make bones stronger and some things that make bones weaker. But in general, the bone is a very strong tissue, and when we think about the anatomy of it, remember what we talked about in chapter 1, the difference between anatomy and physiology. This is more of an anatomy thing because it's a functional thing, but having the hollow center in the bone helps to make your bone less dense and therefore lighter, so it can facilitate better movement. You know, if your muscles are this big and if you have a solid bone, well, our muscles, they might be much bigger because skeletal muscle helps the bone to move. And if we require more energy to move the bone, because the bone would be solid all the way through, then that might create a bigger muscle and out of necessity, and then that would make it maybe more difficult for us to move. Remember, there's a very fine line on our anatomy and physiology, and sometimes, like when you see in the movies, especially the animated ones, like some of the superhero movies where people are just so, they're so big and they're so muscular, it might not be that practical for us. Now, if we had a different anatomy and physiology, it might be different. Then, of course, the endosteum, which is the thin membrane lining that medullary cavity. So much like there's a protective coating on the outside of it, this periosteum, you've also got this endosteum. So that should give you a clue there. Endo means inside, internal. And basically this diaphysis has this membrane that lines the inside and the outside of it. Okay. So this is still here at figure 6.1, and this is just kind of a close-up of the bone. We can still see the cutaway here, the medullary cavity and the diaphysis. So you see that here. And this looks like, see this where it says spongy bone. So this is actually just a magnification. I know even when I look at it, it's almost an optical illusion because it looks like it might be a joint, like this bone is joined to here. This isn't, my opinion, this isn't the best diagram we could have, but it's the one that we have, so we'll have to deal with it. But this part here is just a magnification of this part. What happens here is we have what we call this compact bone, which makes it the diaphysis, and then here we've got this spongy bone, and we're going to define those later on in the lecture, so just bear with me. And this was something I was talking about a few minutes ago, this epithelial line. You can kind of see it. And this is important. This is a layer of cartilage, and there's zones to this layer, and this layer of cartilage actually helps the bone to grow. So all of that will be defined for you as the lecture progresses. So this was just a magnified view of figure 6.1. Let's go into the histology of the bone. Just to review some basic biology, remember histology means the study of cells. So now we're going to talk about what kind of cells make up the bone. So the bone contains an abundant extracellular matrix that surrounds widely separated cells. The extracellular matrix is about 15% water, 30% collagen, and 55% crystallized mineral salts. Mineral salts, calcium phosphate and calcium hydroxide combine to form crystals called hydroxyapatite. We're going to be talking about these 4 different types of cells, and they're outlined for you on page 180. And you can see them here at figure 6.2 on page 181. The osteoprogenitor cells, so progenitor is the beginning. So this is the bone stem cells able to differentiate into other cell types. Remember from your basic biology that the stem cells are just undifferentiated cells. And at some point in your development, they differentiate into nervous cells or cardiac muscle, whatever the case may be. So these are just like the raw bone cells that may be able to differentiate into these other types of cells, which are the osteoblasts. So the bone building cells that secrete the matrix, initiate calcification, and the osteocytes, which are mature bone cells, and osteoclasts, which remodel bones and cause them to release calcium, and they also help with bone reabsorption. We're going to talk about those in detail here in a few minutes, but let me just give you a way to remember this. Osteoblast, B. So B for build, osteoblasts build, and then osteoclasts, C for cut. So the osteoclasts, they actually will break down bone. And as you'll discover as we talk more and more about bone, that your bone has some similarities to your skin. Remember what we said about the skin, that your skin is constantly sloughing off. Well, maybe the bones, they don't work that fast. On a daily basis, you're losing skin cells. But over time, your bones, they break down and they rebuild at the same time. So it's a constant process. I think on the first, maybe if we look back at page 177. Yeah, it says it right in the first sentence, so I'll point that out now. If you refer to page 177, the bone is a dynamic living tissue. So dynamic means that it changes. It's not static. It doesn't stay in one place all the time. Like your skeletal muscle, your muscle, once you get to a certain point in your development, you're done growing, your muscle cells, they don't really change much. And they don't really go through mitosis like your other cells do. But these bone cells, much like your skin cells, are always being consumed by your body and then also at the same time rebuilt. And that's very important for your homeostasis. And we'll get to that soon. On the PowerPoint, this is figure 6.2 on page 181. So you can see the progenitor cell right here, and then that can differentiate into this osteoblast or this osteocyte or this osteoclast. We already talked about these 4 cells, and now you can kind of see a picture of them and what this cartoon says they look like. But if we actually look at the real scanning electron microscope images of these different types of cells, we can see that they are distinct and they certainly have different functions. Again, this figure is back at page 179, figure 6.1. But we're going to talk more about the differences between compact bone and spongy bone. Compact bone is good at providing protection and support. It's the strongest type of bone, and spongy bone is very lightweight and provides tissue support. And then it also has some synonyms to that, the trabecular and the cancellous bone. So here we see figure 6.3 on page 182, and this just goes into detail. So this is an example of compact bone. And so now we're going to compare and contrast compact and spongy bone to these cartoons that your book provides. And I like the way the book defines this. If I could digress a little bit, I actually have some theories on the universe, and it kind of fits into my theory. But if you look at how the bone is organized, you can see that it's similar to the rings on a tree. It's interesting, isn't it? That's one way to identify the compact bone, is that it's more densely packed than the spongy bone would be. So let me just put this into perspective for you. You see here on this little bracket spongy bone, and you can see here compact bone. So this is going to be the outside of the bone, and this is going to be more of the inside. The compact bone actually is kind of a layer that goes around. Remember, the bone's hollow, and then that encases the spongy bone. And I'm going to tell you why all that stuff happens here in a few minutes. But that's the case here. And then if we look here at spongy bone, so this is very important here, concept for you to understand, is that the space for red bone marrow. So remember what I said here, if we go back to this slide, that this is the inside of the bone. And remember, your red blood cells, your blood actually comes from your bone. Isn't that just insane? I think it's crazy how that works. But the red bone marrow is going to be housed, or I should say supported, by this spongy bone, which you see here. So see how it's kind of got these, I don't know if you want to call them fingers, but it's definitely more loosely packed than this compact bone is, because you can see there's probably these are relatively tight junctions, and then when we go to the spongy bone, they're certainly not tight junctions, if you remember from a couple chapters ago. So let's see here, blood supply and nerve supply of the bone on page 184, bottom of the page, section 6.4 in your book. We can see there's periosteal arteries, and they're accompanied by nerves. They enter the diaphysis through the Volkmann canal, and they are accompanied by the periosteal veins. I know this is your first anatomy course, but when we do get to the circulatory system, arteries and veins, they kind of go hand in hand out of necessity. And we'll get to that later. I'm not going to explain the circulatory system tonight. A nutrient artery enters the center of the diaphysis through the nutrient foramen. Nutrient veins exit via the same canal. The metaphysis and the epiphysis also have their own arteries and veins. And we can see that here. So remember, epiphysis is the end of the bone, if we're talking in long bone terms now. Oh, and look at here. So this wasn't on our diagram before. So we've added this metaphysis. That's new. That's the first time we've seen that. Your book was previously defining this whole section as a diaphysis, but we can further break this down into the metaphysis and then, of course, the epiphysis. And again, I'm going to point this out, but you see this line here. This is the epiphyseal line, and this is really just cartilage. But this is figure 6.4 in your book, probably an important figure to study. But we've already discussed the medullary cavity, and then we see the compact bone. And then we were talking about this nutrient vein. Well, we see that here. Remember, just for your reference, the veins are always blue, the arteries are always red, and that's going to be standard throughout your life, whether it's in anatomy and physiology class or whether you go to a hospital and work. The veins are always blue, the arteries are always red, etc. And all the foramen really means is a hole. And we're going to encounter this word foramen all throughout our class. And even when you take AMP2, you're going to see it. Just get familiar with it. It's basically a hole, or I like to define it as an access port, because it gives access to a certain tissue or a certain part of the body. And there, especially when we get to the skull and stuff, you're going to see a lot of this. Okay, so we're going to bone formation, and this is on page 185, and your book starts with the bone formation in the embryo, which makes sense. We might as well start from the beginning. Ossification, or osteogenesis. Let's break this down real quick. Ossify, ossuary. There's a lot of words that start with the OSS prefix, or even OS in the case of osteogenesis. But you see that when you see that, you know that that's related to bone. That's a good prefix to be familiar with. So osteogenesis, Genesis means the beginning. Like Genesis is the first book of the Bible. Genesis is the beginning of something. The beginning is the process of bone formation. Ossification is the process of bone formation, the beginning of the bone. Bones form in 4 situations: embryological and fetal development, when they grow before adulthood, when they remodel, and when fractures heal. And there's 2 types of ossification that you should be familiar with: intramembranous and endochondral. Intramembranous ossification occurs in flat bones when a connective tissue membrane is replaced by bone. So this is actually lecturing from figure 6.5 on page 186. So you can see there at the beginning, we have the development of the ossification center, and then that moves into calcification. So anybody who's experienced with babies, when you have a baby, you have to support the head. They're a little more fragile than an adult is. And that's partially because their bone tissue isn't 100% developed yet. And when conception happens, and then the zygote, and then the blastocyst, and all of the different phases of development in the womb, you have the bones are essentially start as cartilage. And then as time goes on, as life goes on, calcium starts to come into the picture, and it starts to calcify this cartilage tissue. And then you see the formation of the bone in the tuberculae. And then you've got the development of the periosteum, and we talked about that a few slides ago. So that is a very basic way that bones can form. And this type of this intramembranous formation really refers to flat bones. Yeah, maybe the book didn't do a good job of this, because why were we talking about the contrast of flat bones to long bones? But you've basically got long bones, and then you've got flat bones, and the flat bones are the bones in your sternum. So here's another type of bone formation. The endochondral bone formation, or ossification, replaces cartilage with bone in the developing embryo and fetus. Remember what I said, when you're first conceived, and as you develop what is going to become your bone, as your cells start to differentiate and you start to form this connective tissue bone, it actually starts as cartilage. And then we can see the differences here from the intramembranous formation to this endochondral formation. We've got the development of the cartilage model. So this is basically cartilage. And then essentially what happens is this calcified extracellular matrix starts to form within the bone. And this is the growth of the cartilage model. And then the development of the primary ossification center. So remember, ossification is just the development of bone. So it's too bad that they don't put this in like weeks or months for us. But however many weeks this is, however many months during the pregnancy, you start to see ossification, osteogenesis, the beginning of bone formation to occur. And then the fourth stage of that development, we see the medullary cavity form. We already see that in stage 3, we're already seeing the blood vessels entering in here. But now we've got the nutrient artery and vein coming in, so it's more and more developed. 5, we've got the development of the secondary ossification center. And this is important because the secondary ossification center will start to occur either on the distal or proximal or distal end, depending on how you're thinking of it. But you understand what I'm saying is that the two ends of the bone get this secondary ossification going on. And this is going to be very important because this is how you notice this here, this kind of purple area here. And that on stage 5 is going to form our epiphyseal plate. And this is very important to our growth and development because this plate, and I know I'm going to talk about it in a couple slides here. I just want to define it now. This plate is where a long bone, especially, is going to be elongated because all of this cartilage that makes up the epiphyseal plate will eventually calcify during your development as a toddler and a young person, a teenager. As you grow, eventually we get to a point where, when our adulthood, where we stop growing. You get to that point where you stop growing, and then there's certain reasons that happens because of your physiology, and we'll talk about those as the lecture progresses. I just want to again emphasize here that this epiphyseal plate is very important to your growing. And then what do we have here? Okay, so it does give us 12 weeks. So all of this stuff is happening within 12 weeks. And then the 12-week-old fetus, the red areas represent bones that are forming, and the clear areas represent cartilage. So you can see here kind of, I guess, what they mean by clear is the dark orange and light orange. And so you can see the light orange is uncalcified and the dark orange is calcified. So that kind of puts it a little bit into perspective here. About 12 weeks, you've got a pretty complete skeleton, and your calcified and uncalcified parts are going to continue to develop. All right, so bone formation. This is here on page 189, figure 6.7. The endochondral ossification also occurs in the epiphyseal plates of long bones as they grow in length. So this is kind of what I was talking about just a few minutes ago, why this is so important. So you can see this epiphyseal plate, which is the boundary or the separation of the epiphysis and the diaphysis of the bone. You see that there's 4 zones that relate to this epiphyseal plate. And remember what I was saying earlier, just a few minutes ago, this zone of calcified cartilage. So this is all just cartilage here. And as this cartilage, over time, it calcifies, then that's going to turn into solid bone. And that's how your long bones grow. That's how you get taller. That's how your arms grow. And then here's just a micrograph. This is a light microscope image of this section of bone. You can kind of see it here in this. Is this an X-ray? It looks like, yeah, a radiograph. So here's an X-ray of it. And it gives us this little square here, which is magnified here under a light microscope by 400 times. And you can see this epiphyseal plate and these different zones of cartilage. And then notice how here we've got the epiphyseal side. And notice how this zone of resting cartilage is very similar to this epiphyseal side. This cartilage, just as time goes on, as you're a toddler, as you're a young person, as you're a teenager, this starts to turn into bone, and that is how your bones elongate. Moving on to page 190, figure 6.8. Bones thicken thanks to cooperative action of osteoblasts and osteoclasts. So this diagram goes through how the bones are kind of forming around those blood vessels. So we see we've got an artery, and we can see that as this cartoon progresses that, wow, what does that look like? It looks very much like a cell, don't it? Isn't that kind of how cells can form? If you've ever witnessed phagocytosis. So you should be familiar with phagocytosis from your basic biology classes. And isn't that kind of what it's doing? That bone tissue is invaginating, and then it's going around that artery, and then eventually it's encompassing that whole artery. Very reminiscent of phagocytosis. Again, this isn't phagocytosis. Don't misunderstand what I'm saying. I'm saying that this is similar to that process. It's just a different kind of tissue and a different level of organization in your body. So we see first that ridges in the peristeum create the groove in the peristeal blood vessel. Okay, so we see this groove being created. And then we see this periosteal ridge fuse, which is happening right here. So I was talking about, it's almost like a phagocyte, And remember what phagocytes are part of your first line of defense. They're just your immune system that they will take in foreign invaders to your body and consume them for food. So yeah, it's not the same thing, but it looks very similar to that to me, and that's why I want to point it out to you. We see similar processes in all of our systems, and you'll see that as the class progresses. So let's see here. The osteoblasts in the endosteum build new concentric bone lamellae inward toward the center of the tunnel, forming a new osteon. So remember, we talked about osteons several slides ago. An osteon. So here what we're witnessing in that cartoon that we're talking about right now at figure 6.8 on page 190, we're witnessing the formation of this osteon. And then we see the bone grows outward, and the osteoblasts in the peristeum build new circumferential bone lamellae. Osteon formation repeats as new periosteal ridges fold over the blood vessel. Eventually this stops, because a lot of this stuff is happening while you're an embryo and while you're a young person. But when you become an adult, the stuff stops, and unless you get a fracture or something, then that might change. But certainly this is part of your growth and development here. And then this is just a continuation of figure 6.8 on page 190. And we can see it shows on the left side the bone, and then it shows the progression of the infant to the child to the young adult and to the adult, which is kind of what I've been talking about this whole time. I've been very specific about which parts are for the infant, which parts are for the adult. And so, like I said, once you get to this point, things like this are going to stop happening because you stop growing. So they can't happen anymore unless there's a break or a fracture or maybe some other physiological things that can happen that may cause. Remember, the bone is a living, dynamic tissue. So, it's possible that in your adult life that if something traumatic happens, that your bone can repair itself to a certain degree. And, if you do have a break, a lot of it's going to depend on, how quick can you get that set? Is it set properly? I broke my arm, and I've broken a few bones actually. And, I can't even tell I broke my arm. So my doctors did a good job of resetting my arm. I'm pretty good to go. I broke it when I was young. That's another thing. And we talked about this in the previous chapter too. Infants and children, young adults, they're oftentimes more resilient than adults are in that realm. If they get a broken bone, it's easier to heal than if you're 50 years old and you get a broken bone. And I'm not saying that if you're 50 and you get a broken bone, you can't heal, because you can. It's going to take more time, and as you go through that aging process, you're not as resilient. So just something to keep in mind. So what this slide says is that as osteoblasts deposit bone on the outer surface, osteoclasts widen the medullary cavity from within. So notice that the diameter of this internal cavity is much greater than the diameter of this cavity, which makes sense. I guess it's all proportional. And then I'd like to point out here, while I'm thinking about it, that here on the outside of this bone, we've got the compact bone, and then you can see here on the inside the spongy bone. So that's kind of how the bone is laid out for you there. Okay, so bone growth. Factors affecting bone growth and bone remodeling, page 191. Minerals: calcium, phosphorus, magnesium, fluoride, and manganese. Let me put it this way. If you think about your body, or your friend's body, or your partner's body, or your patient's body, who just think about a body. It could be your dog's body for that matter, your cat, if you've got a pet. This outside, this skin and this muscle is what we call soft tissue. Not so much with the bones. If you took me and I died and I got buried under some snow and ice, or I got buried in the right conditions, I might form a fossil. So bone can give us an indication of history, the history of the world. For instance, if you've ever been to the Chicago museums, or the field history museum, the natural history museum down there, they've got the dinosaur bones, and we can see, we can estimate, I should say, what kind of shape and form that those organisms had when they were living on the earth. But we're hard pressed to find soft tissue unless it's frozen. Like tonight, it's very cold out. There's a lot of snow out here in my lot. Jeez, I was like, gotta go out and shovel after class. Point is that if I'm out there shoveling and I keel over and I get buried in this ice and snow, and then all of a sudden an ice age comes, well, you might be able to get some of my soft tissue and take some of my DNA and find out what we were like millions of years ago. But because of your bone relates to minerals, in the right conditions, those minerals can become fossilized. Just something I like to point out to the class, because I think it's significant here. Out of all your tissues, your bone is the one that has the potential to survive for thousands of years, if not millions of years. And that's because it relates to these minerals. Vitamins, it also has to do with vitamins. And you can see here that important vitamins for your bone are the A, C, D, K, and B12. And if you're going to take B12, I would just take B complex, because B complex is awesome. It has so many benefits to your mitochondria in your bone. Just take the B complex. Don't even worry about the B12. B12 will be in the B complex, so there you go. Also, hormones also relate to your bones. We see these IGFs here. They're stimulated by the growth hormone, which growth hormone helps to signal your bones that you need to grow during your growth years, like your adolescence, your teenage years, your growing. Hormones are helping with that. And your sex hormones, certainly, once males and females reach puberty, their sex hormones start to kick in, and then their secondary sexual characteristics start to become more defined. And that's very important for your bone too. And let's see what the next slide says. So we're going to go into fracture and repair of bone. And I'm on page 192, section 6.6. A fracture is a break in the bone. Many different types of fractures occur. The healing process involves 3 different phases and 4 steps. First, you've got the reactive phase, which is the inflammatory phase. The reparative phase includes the formation of fibrocartilage callus, and then the first and a bony callus second. Fibrocartilaginous callus forms first, and then the bony callus forms second. That's apparent at figure 6.9, which I was going to tell you about in a minute. The bone remodeling phase is the last step as the bony callus is remodeled. So let's see what the next slide says. Aha! Figure 6.9 there on page 193. So we see that we get some kind of a fracture, and then we see what happens first. We get a reactive phase, which is just a standard immune response. If you've ever had a broken bone, you know this. You might even have throbbing there because you got so many cells or parts of your immune system just rushing to that area to take care of it. And then we see section 1A where we get this fibrous cartilage callus formation. So basically it starts to callus over. And then we go into this reparative phase where we start to get the cartilage starts to form bone. And remember, it's not impossible, right? Because we were talking about that epiphyseal plate, which is just cartilage in your long bone that will turn into bone and help you to grow. And then we go into this bone remodeling phase here on number 3. The book goes through several kinds of fractures. I'll let you go through these and read them yourself. And as you know, you've taken enough of my quizzes and exams now that you should know that I wouldn't be surprised if I pull a question out of this table 6.1 on page 194. But let me say at least 1 or 2 things about this table. First, there's different types of fractures, and there's different kinds of ways that the bone can be broken or hurt. And some of these names may represent what the fracture actually is, or it may represent the person who first described it. There's a number of different reasons why they have a certain name. But if you look at that table 6.1 on page 194 and 195, it goes through all this stuff for you. So we see we've got the open, the comminuted, the green stick, the impacted, the pop, the coals, and the vertebral compression fracture. None of them sound too pleasant to me. Believe me, I've had broken bones before, and it is not something that I would wish on anybody. So if you've never had a broken bone, you're lucky. Let's see here. Bones roll in calcium homeostasis. Oh, yeah, this is good. This is the stuff that I like. So I'm on page 195 at section 6.7. So 99% of the body's calcium is stored within the bone. The parathyroid gland secretes parathyroid hormone when calcium levels drop. Then, when the calcium levels drop, osteoclasts are stimulated to increase bone resorption, and calcium is released. The parathyroid hormone also stimulates the production of calcitrol by the kidneys to increase calcium absorption in the intestines. Interesting stuff, huh? What's going on? Aha! Doesn't this look familiar? First chapter. What will we call that? Well, it looks very much like a negative feedback loop to me. And that's how your body regulates calcium, in a negative feedback loop. So you see you've got the stimulus, the controlled condition, the receptors. You got some input, the control center, which is your parathyroid hormone gene. You've got an output where osteoclasts in your kidneys kick in, and they give you a response, and then it returns to homeostasis. Calcium is a very important mineral to your body. Before we go on to this, I just want to say, if the calcium ions in your body drop, you could stop breathing. It's so important. Calcium is so important to your body that it can affect your breathing if you don't have enough of it. If you have too much of it, it could stop your heart. You could go into cardiac arrest. So this is a very important concept to understand here, class, this idea of calcium homeostasis, because much like many of the systems in your body, like for instance, the pH of your body, it needs to be about 7.4. And if you start to go over or under 7.4, you could go into alkalosis or acidosis, depending on where you're at there. And it's similar here. It's just another version of that, but this could affect your breathing or your heart beating. So it's very important to regulate your calcium. Aging and bone tissue. Oh, exercise and aging in bone tissue. Okay, well, 6.8 and 6.9, page 196 and 197. From birth through adolescence, more bone is produced than is lost during remodeling. In adults, the rates are the same. Older individuals, especially postmenopausal women, experience a decrease in bone mass when reabsorption outpaces deposition. So we see normal bone, see how it's a little bit dense. And then when we see the osteoporotic bone, see how there's kind of these voids in the bone. There's reasons that women are more likely to have osteoporosis than men. The male sex hormone testosterone gives the male, the ability to create more muscle and bone mass. Estrogen, not so much. I'm not trying to diminish estrogen in any way, but because women, they don't produce testosterone. Now, they do produce androgen, which is the precursor to testosterone. But because women don't have testosterone, or if they do have testosterone, it's in very, very small quantities. Their bone tissue isn't as great as the male bone tissue. And then when they reach menopause and their sex hormones change in the way that they are presented to the body, you have less estrogen. And then that's going to start creating problems with your bone mass because you have a hard time depositing bones there. And that's defined there on that slide. But I think the book gives a statistic that 80% of all cases of osteoporosis is involved in the female of the species. So something to think about. So for women especially, exercise is important. It has been shown that there are benefits to exercise to the bone, because when you put strain on your bone, it helps to give you more mass to that bone. Remember, the bone's a living, resilient tissue, so it will respond to your stimuli. And if you're doing push-ups, jumping jacks, lifting weights, that can help you in the long run. And I'm not saying you have to go out and be a fitness nut. I'm just saying that you got to go out and you got to, sometimes, especially with a younger woman, you're young and you're invincible, right? When you get older, you might hit this thing called menopause, which you will. And if you've thought about it a little bit while you're younger and done a little bit of bone mass building, maybe take some calcium supplements in your diet, then that can help to mitigate some of those effects of the bone osteoporosis that may occur. And again, not all women get it. I'm painting with a very broad brush here. I'm just trying to give you information for yourself and for your patients, because I know most of you are going into the healthcare industry. One other thing I wanted to say about that: exercise, diet. Oh yeah, diet's another very important thing here. Like I said, you can take some dietary supplements for calcium, especially while you're young. If you do that stuff, it can help to build better bone mass to last you longer through your life, and then help to avoid osteoporosis. So some things, they just have to be, I would call, front loaded. Sometimes when you're young, you have to think about stuff, and you're lucky to be here. If you're young and your patients are young, whatever the case may be, you're lucky to be here and getting this information. So I'm sure that my parents or my grandparents' generation, they might not have had access to this information, so they might have had a harder time with it. But you take calcium supplements, if you diet and exercise, it can affect you in the long term in a positive. And that doesn't only go for women; it goes for men too, because men can be affected by osteoporosis. It's rare, but it does happen. Just common sense, I guess, to kind of take care of your young body, and your older body will be in a better condition. Avoid smoking and drinking and all that stuff for sure. Other thing I wanted to say was, I remember reading in graduate school, it was an assignment in a class. It's been several years since I've been in graduate school, so there may be more studies on this now, but they were showing that women who drink soy milk when they're young, when they're in their teens, when they consume soy milk, that they have a lower risk of getting osteoporosis. So that is a true study, and you can look that up and make your own decisions about your diet, especially if you've got, maybe you're older now and you've got teenage girls, if you've got teenage kids, or like I said, your patients. It's another thing. And don't just take my word for it. Go out and do the research, look it up, figure it out. But there is some merit to drinking the soy milk. And I don't remember all the details of the study. Anyway, let's continue to go on. So we've got the summary of the factors that affect bone growth. Here we have the minerals. So you've got calcium and phosphorus, magnesium, fluoride, and manganese. This is table 6.2. So I'll just go through it real quick, but you can study this table by yourself. And table 6.2 is on page 198. And then we also have vitamins, and we talked about this briefly: vitamin A, vitamin C, vitamin D, vitamin K, and B12. And remember that this calcitrol, we were talking about it last lecture. My point is, with the vitamin D, activates that calcitrol, so it doesn't hurt to go out and get a little bit of sun, because it helps you to activate that vitamin D, and that helps to take care of helps to build bone. All right, so the vitamins. And then, of course, the hormones. We talked about that a little bit, the sex hormones and growth hormone, insulin, etc. Parathyroid, very important. And then exercise. Oh, yeah, we already talked about, I was talking about exercising and how that helps to stimulate the osteoblasts, and it helps to build your bones up into stronger and thicker bones. And then, while I'm remembering all this stuff, another thing to think about, I'm assuming that all of us in college are adults, but if we've got teenage children, or if you've got patients, you can advise them, especially kids that are going through puberty, or maybe even prepubescent a little bit, to have them do the exercise, even lift some weights. And I'm not saying they have to be like Arnold Schwarzenegger weightlifting, just a little bit. A little exercise is good. They also say that the benefits of exercise, they go beyond your bones. You kind of keep your body and keep it toned, and it affects your personality. People who exercise regularly are less likely to be depressed. a lot of benefits to exercise. Disorders and homeostasis imbalances. I'm lecturing from page 197. And osteoporosis, that's what I was just saying, that it's the bone resorption outpaces the formation, and 80% of those affected are women. So it's mostly a disease that women are concerned with, but not 100%. Rickets and osteomalacia is an inadequate calcification of the extracellular bone matrix. Rickets affects children and leads to bowed legs and deformations in the skull, rib cage, or pelvis. Basically, rickets is like children that have soft bones or spongy, not spongy. I don't want to use the word spongy because I don't want to get you confused with spongy bone. I want to say their bones are rubbery, creates some problems. Like I said, bowed legs. So if somebody see somebody with bowed legs, the chances are when they were a kid they had rickets. Osteomalacia affects adults and causes painful tender bones and fractures with minor trauma. And then the medical terminology is there on page 199 for you to look at. The osteoarthritis, which arthritis is just an autoimmune disease. Osteomyelitis, which is an infection of the bone often caused by Staphylococcus aureus. Osteopenia, which is reduced bone mass below normal. And osteosarcoma, which is bone cancer. And that's I had a good friend who actually died from it. I know he didn't have a good time at the end of his life. Osteosarcoma is very serious. Well, that concludes our lecture tonight, class.